Welcome back to the WHHI News. We're going to have some more family care practitioners here around our area, thanks to Novant Health. Joining us now is one of those people who will be helping do that. She is Alexis Riccione. She's a family nurse practitioner over in the WHHI area. What is the expansion, or what does it mean to you, Alexis? What are you up to over there?
So recently, Novant has made a huge investment in our community and in the Lowcountry, specifically through Hilton Head and through this area as well. There was a notable need as our population has grown significantly over the last couple of years, that we need primary care. You know, patients need those family medicine doctors to help them get good, proper care, you know, full body care, and also get them over to any specialists that they may need in the area. And so because of this, Novant recognized that this was a need as our population is growing quite a bit, and has invested in hiring over 10 primary care providers for our area that are coming over the next several months.
Well, that is good news for people in our area. Talk to me about how that family care provider really is that first person someone will see and maybe be directed to others, but also in regards to chronic care issues too.
Yeah, so your primary care provider, family medicine provider, however you like to refer to us as, we're very important. We're essentially like the base of the healthcare foundation. We're your starting point. We are your launching point. We get to know you. We're the ones that you have the biggest relationship with because we see you the most often, and we're taking care of you throughout your lifespan, whether that's from young childhood and through adulthood. You're going to see us through that entire span. And so because of that, it's important that you see us to help you, one, establish care, B, help manage like any of your chronic medical conditions, get your prescriptions. And if we start to see that there's abnormalities in lab work or your condition or your clinical presentation, we're able to identify that quickly and get you over to the correct specialty offices to help you get taken care of.
You had mentioned to me before we started interviewing that you moved to the area in June. Being here in the role that you're in, what are some of your goals as you work with patients and over at WHHI Primary Care?
My biggest goal is to establish, you know, a real relationship with you, make sure that you're well taken care of, that all of your needs, you know, healthcare wise are being met, and that I can ensure that you're getting to the proper people and getting the proper care that, you know, is required to maintain your health, because our goal in family medicine is to keep you as healthy and as functional as possible for as long as possible.
You really have to be knowledgeable in so many areas as a primary care provider, in general, like a lot of different areas. And then you mentioned referring out to specialists if need be. How do you determine when you need to do that? It's got to be somewhat challenging.
It's a multifactorial. So one, it's your clinical presentation when we see you. Two, we'll be evaluating lab work. Three, we'll be looking at your response to medications. Any diagnostic imaging, we would also be utilizing to better determine, you know, what is right for you. Some patients, it's very easy. It's an easy blood pressure management. You know, we can manage that with medications and routine lab work. But some of our patients that have more advanced cardiovascular needs, you know, that's when we know, oh, they need to go over and see our cardiology, you know, partners.
It's interesting that this expansion, as you mentioned, is going to involve a lot of providers. Can you mention again, I know you work at the clinic in WHHI. What are the other locations again?
We have some more that we've opened up more positions in Bluffton and in our Hilton Head office. We've already had two PAs come and 2 physicians so far, and I know that we have several more coming into our area.
As someone who works in, you know, primary care, you really have a long-term relationship with that patient, don't you? If they meet you at a young age, I mean, you may be with them for years, right?
Yes, and often we see more than one person in the family. Right. So it's not abnormal for me to see the mom, the dad, and the children, even into adulthood, and sometimes even the grandparents. So this really gives you a true clue into the patient's full clinical picture and their needs. So when they're really going through it, maybe a family member is very ill and they need support. I already have known that because I already had a relationship with the other previous family members as well. So it helps me take care of them.
I didn't mean to cut you short there, Alex Riccione. We are very glad you were here, family nurse practitioner who's working over in WHHI. Thanks so much for your time.
Yes, thank you so much.
And we will be back in just a moment.